morning and welcome once again to a resident council presentation. We are here at the Meadows, and today we are going to hear from Brian Opoka, who is the Director of Public Safety for John Knox Village. And as all of you know, he has done a terrific job of sticking with this COVID-19 situation and letting us know what's going on. And he is going to talk about the progress being made on campus and including the response of residents to the public safety response. Brian.
Well, thank you for having me today. To kind of go back into the history of all of this, we really started back in January in working with vendors for our healthcare areas to ensure that we had a good adequate supply of PPE to be able to meet the demands that we saw that was coming. Everything started on the East Coast and worked its way through the U.S. Now that it is here, we really had no idea that it was going to be as long and drawn out as it is, but in February we put together a COVID-19 incident command team, and we've been working from that incident command team since then. We have leaders in all of the healthcare areas as well as independent living. We work together to be able to troubleshoot problems and to be able to put plans in place. And as a whole, everything went really well here for John Knox Village. I feel like the amount of people that we have here, the great communications that has been put out there with the residents as well as the associates, I feel like has really helped. And that development of that incident command team is the great success of that, and being able to have all that leadership to work together and be on the same page to put the clear message out there for everybody, so everybody has the expectations, knows what we are doing here at John Knox Village, has provided a great success that we've had throughout the pandemic. I feel like that moving forward, there are things that are constantly changing with regulations. We stay in contact with the recovery plan team, with the Jackson County Health Department, as well as the Department of Health and Senior Services, as well as CMS, to ensure that we're following the guidelines that are put in place to ensure that the residents as well as the associates stay safe during the pandemic.
Okay, I did not realize that John Knox and Public Safety were already responding in February, which may have gotten ahead of the game before the federal government did.
Well, in January, we started working to ensure, because when you have something that large that is happening, you want to make sure that you're ahead of the game to where you have your proper personal protective equipment in place. So we started working with vendors ahead of time to make sure that we have an adequate supply here. I will say that that was a success. We have always had a adequate supply to be able to meet the demands that we have going on here at the village. And now that the pandemic has been going on for a while, there has been shortages throughout the whole entire thing with PPE, but we have continually had that adequate supply that we need to be able to do what we need to do here. And if emergencies come up, now that we've been in the pandemic for a while, we have contacts with the state to be able to get things here as quickly as just a couple of days.
I'm curious, and of course I've told you this already, that your reports about what's going on with COVID-19, your reports that are in the e-blast are so thorough. They tell us exactly how many associates, how many residents, who's doing what, who's back to normal and so forth. I'm just curious, did you create that style of reporting, or was that something that's available to everybody in public safety nationwide, or what?
That really is part of that JKV incident command team that I spoke about.
Okay.
There is a handful of people that are behind the scenes working to put all that together. We work together to make sure that we have the communications put together, and it's gone through a dozen times before something is put out there. Everybody gets a good eye on it, and then once everybody is okay with the message, then that message is sent out. That's one of the keys to working through this pandemic, is making sure that you have great communications. The communications here at John Knox Village are very top notch.
Yeah.
We do a great job of making sure that everybody is informed.
Yep, it just never ceases to please me so much. Same thing with Mary Beth Roberts speaking last month, and Eric Scott the month before. John Knox just seems to be well organized in dealing with issues, positive or negative, and it's very thorough. So I'm very pleased to see that, and certainly glad to be living here, and so is my wife.
Well, I'm glad that you guys are here, and I'm glad that everybody else as well that is here. I feel like that we have put together a very safe environment for everybody to live your day-to-day. I know that some people may not be happy with what we have going on, but we have been able to accommodate some things we opened up the pools in the fitness centers. And we've opened up the hobby hut. We've opened up a couple of things with some restrictions in place. But to be able to do those things, we have to work with the local health department and the county to be able to get those permissions. So they went through our plan of action to be able to do this in a safe practice for the residents. So everything has to be okayed through the health department and the county to be able to make those things happen. So we have been successful in being able to set some things up. There are a lot of things that we have not been able to do because John Knox Village has so many buildings and so many great amenities. It's going to be a slow process that we're going to take to be able to open everything back up. We got to make sure that everything is safe before doing so with proper procedures in place.
Yeah, and of course I know it's needed and it's the right way to go, but having Jackson County and the health departments and whatever kind of telling us what to do, that can be frustrating. For example, and I'm not complaining, but heavens, I would never do that. But as my wife will tell you, it just seems like if you've got a committee of 6 people, it should be okay to come into this room and spread out and wear masks. But that's not John Knox saying you can't do that. That's the health department. That's Jackson County, and so we're kind of stuck with it, I guess. And
we are. We need to make sure that we're following the recovery plan. That recovery plan was put together with a committee of experts in epidemiologists, emergency management, and doctors, and there's a lot of input that is put into place to be able to make sure that everything is safe. The phases that they have are set up on the criteria based on the amount of cases that are in the county. So we're in phase 2.5 right now, and there's a phase 3 and a phase 4 of the recovery plan that there is no time limits on it. However, there are case numbers that are tied to the process of when we move into the next steps.
Okay, so as things improve, I guess we would eventually move into phase 3 and then phase 4, but we have no idea when that's going to happen.
Correct. So right now, 2.5, 3 is the next step, 4 is the next step. The frustrating thing about that is those steps could also go backwards depending on what is going on in the county.
Have we had, and I'm not looking for numbers or heaven forbid names, but have we had a problem with some folks on campus, residents or associates or whoever, that don't quite follow, I guess you'd say, the rules? Has that happened much?
The amount of people that we have here, there's a tremendous amount of people here on the campus. I would say that, yeah, not everybody is
Right.
following the rules. I would say for the most part that everybody is following the rules, is very appreciative of what we're doing to ensure everybody's safety. There's a lot of things, caregivers are allowed to come into independent living, so a lot of that provides confusion because you might have resident A see resident B have somebody come into their home, but they don't really know that there very well could be a caregiver. Those caregivers are allowed to come in to assist the residents in independent living. They have to come to public safety to get screened. Then they are cleared, if they pass the screening, to be able to go into the independent living areas to assist those residents. So a lot of that is going on out there is warranted. If, somebody may need help with being able to set up their prescriptions, make sure that they're taking their prescriptions, make sure that they're getting a healthy diet, and making sure that they're getting clean laundry and getting assistance getting up in and out of bed. Those things do happen in independent living here at Knox Village, and we allow that. We want our caregivers to be able to have access to those in need in independent living.
Yep. I have said several times that John Knox is, to me, a good example of what can be accomplished almost anywhere if you do follow the rules of wearing masks and social distancing and minimizing your contact. I mean, I realize we have sort of a controlled situation here where it's fairly easy to social distance and so forth. But to me, John Knox is really solid evidence that those kinds of things work, and we're better off listening to the health experts than we are to politicians, I guess you would say.
No, I would agree. That the guidelines that are out there, the recovery plan that is out there, information from the CDC, Department of Health and Senior Services, we are following those and ensuring that our staff is following that, and we're leading by example for the residents to be able to ensure that everybody does stay safe. We have an independent living. We have been doing an absolutely fabulous job in some of the healthcare areas. We have had some hiccups to where we have had some cases, but those are more of those areas where you're working close with somebody and you don't have the potential to be able to social distance and be able to get the things done that need to be done. We have practices in place and screening processes and testing processes for those areas. We catch those very quickly to where there's not a spread, and we take the proper steps to make sure that that individual recovers quickly, whether that's a resident or an associate.
Sounds good. I guess it seems to be a safe assumption that as far as getting the COVID-19 showing up with an infection, even asymptomatic, say in the care center or assisted living, it's probably coming from off campus. I mean, if it were coming from on campus, I should think we'd have quite a spread of COVID-19.
Yes, for the most part, the positive cases that we have, there has not been any indication by going back and retracing steps that any of this was something that happened here. It was something that was more than likely brought into the village. And their individualized cases, there has not been a show of a spread other than possibly last week over in one of the healthcare areas, but we got that under control very quickly, and again have put together our plan that we have of action to be able to ensure that those people, those staff members are not with our residents and they're off campus recovering.
Okay.
And will be doing so until they are able to return back to work healthy.
Now you became Director of Public Safety, what, a year ago?
Well, it seems like forever. But yes, it was May of last year.
Oh, it was, okay, all right. And I'm sure when you took the job, and I know you were glad to take it and you've done a fine job, but I'm sure you never guessed you'd be involved in something like this. Did you ever think to yourself, gee, I wish Craig would come back?
Well, we always prepare and we're always ready. We don't want to have to deal with something like this, but we're always prepared and ready. We've been through a lot of training. Our pavilion has been a closed pod that has been set up with the health department for many years. We've been through the pod training, whether that's open or closed. Closed would be for associates and residents and family members of the village, and open would be for open to the public. So we've had that pod training in place, and we actually did that with the H1N1 back a few years ago over at the pavilion. So we're prepared, we're ready, but you're never, until you really experience something. I've never experienced a pandemic in emergency management that has lasted this long, and we still have a long ways to go. But we do have the training, and we have the great tools here at John Knox Village with all of our great leaders to be able to ensure that everybody stays safe.
Yeah, I guess there's probably no one on campus who thought it would go this long, but now we know it could be a while. It's not going to disappear quickly. Let's see, the pods, tell me a little bit more about exactly what they are and how they work.
So we have an agreement set up with the Jackson County Health Department to be able to utilize the pavilion as a closed pod. POD stands for point of distribution. So when you do have a pandemic, you can open that pod and be able to vaccinate people through that point of distribution.
Okay.
So we have the abilities, we have the plans that have been in place again for many years to be able to do that here on our campus. Our campus is so big and so large, and again, a ton of amenities. I've never seen a place like John Knox Village with the amount of amenities that we have. We have the abilities to be able to do that, not just for the campus, but for the community as well, if that was something that we chose to do.
Okay. Anything else?
I don't really have anything else other than to tell you guys thank you very much for taking the time out to listen. I hope that everybody stays safe and well during this pandemic. We're doing everything that we can here on the campus to ensure you guys are safe and well as the associates.
Okay, thanks very much. I'm really glad Brian could be here today. Obviously, he's got a good handle on the situation, and as so does John Knox in general. And we need to kind of hang in there and work with those folks and get through this whole thing. So again, thank you very much, Brian. Next month, we're going to have Todd Hollander from Dining Services, and I think it'll be interesting to hear him talk about the response of Dining Services to the COVID-19 situation, where you're no longer waiting on people in restaurants, but you're delivering meals, probably more of them than ever, and you're handling drive-up, which I think is going very well. So we will see you next month.